no better person to answer my questions and yours than Dr. Cora Constantinescu, who's back, the head of the Vaccine Hesitancy Clinic at Alberta Children's Hospital. She's a pediatric infectious diseases specialist as well, and she's in Calgary. Good morning.
Good morning.
I am delighted to have you back. This is such an important time trying to get to the last Canadians who have not made the decision to be vaccinated. And I have questions that people want to put to you, Dr. Cora. Let me ask you, first of all, what are you hearing right now at the clinic? What are the things that are coming up first, very frequently that you're having to answer from Canadians?
We get a lot of questions about natural immunity. And we hear a lot about, is natural immunity as good as having the vaccine? Can I rely on natural immunity if I've had previous COVID disease myself in the past? So we hear that a lot.
And what do you say to them? How do you answer that?
So first and foremost, I have to say to a lot of people that I think there is value in immunity that people have had from COVID disease. And it seems to be that we have a few months potentially where people are protected after having immunity from the disease. But what is really interesting, Heather, and I tell you, I'm in this group because I've had COVID in the past and I've still had 2 doses of the vaccine. And I had COVID before the vaccine was available to me. And the reason I've done that is because now we have more and more evidence that shows that if you have natural immunity alone, so if you have immunity from the disease, you're 2 times more likely to get reinfected than if you've had immunity from the disease plus at least 1 shot of the vaccine. So there is still great value in boosting that immune system, especially when it comes to the Delta variant. So this is where a lot of these recommendations are coming from, and knowing that with a vaccine, you're still a lot better off, better protected than if you had to just have the disease and immunity from that.
Okay, that's a very important starting point. Some of the things that I've been talking about in recent weeks, the things that surveys show us in Canadians may be hesitant to get a shot because there is a general distrust of vaccination, or they are fearful of the side effects. And we got a question from Colette that speaks to this, Dr. Cora Constantinescu. She says she's curious if there's any part of an egg used to produce the vaccine. Many people have stated that if they get a flu shot, they have a reaction to it. So would the COVID vaccine do the same thing? Again, coming back to this point of hesitancy and concern about side effects as being a reason they don't get the shot.
Yeah, so we are seeing a bit of that. I want to quickly address the egg question because it applies to, so there's no egg in the COVID-19 vaccine, but that we used to recommend to people that if you were egg allergic, you could not have the full flu shot. But that is no longer the case. And there's been some great Canadian studies actually that showed that even if you have had full egg allergy, you can still safely get the flu vaccine in a regular place. You don't have to go to your allergist to get it. So strong recommendation that for both COVID and flu, people can go ahead and have the vaccine, even if they've had egg allergy in the past. But you're right. And we do see people being kind of at a different place right now. We are seeing people come at this hesitant from a deep place of mistrust of governments and health agencies, some very deeply rooted ideologies, a lot of cultural trauma in some cases, and in a lot of people who are hesitant, we see that they've had a negative interaction either around vaccination or with healthcare providers in the past. So that is important because we can change with a positive interaction, even if we don't change immediate intent. We might still change opinions and intent down the line.
Question from Stephanie. And this is, I don't know if you're seeing a lot of people or people are asking you who are pregnant women or women who hope to become pregnant in the near future. And as Stephanie quite rightly points out in what was a very lengthy note to me, it's really being categorized or characterized, Dr. Cora, as for pregnant women, high risk of complications or death, COVID in a pregnant woman, or potential side effects of the vaccine. So she's 43, 27 weeks pregnant, and has had several miscarriages, and is really wondering about the inflammation experienced from RNA, is that similar? Is that experienced by the fetus? Percentage of miscarriages that occurred in Canada before versus now? And the difference in processing an emergency use vaccine versus other vaccines that may be a little bit more further and more fulsomely or fully developed, I guess. Has anything been hastily done, for example, rushed in the process? So there are lots of questions from pregnant women. Hers are very specific. I don't know if you're hearing things like that, but how do you counter the hesitancy in that particular group of Canadians?
Yeah, a lot to unpack there in Stephanie's questions, but pregnant women are an incredibly important group right now. We're seeing more pregnant women with COVID in hospitals and ICUs than we have before. They're an incredibly important and vulnerable group. If there is a pregnant woman with COVID, they have 20 times higher rates of death and poor outcomes than if they did not have COVID. So it's a big deal in pregnancy. It's bad for the mom, seems to be bad for prematurity, for the baby. So there's so much to protect in that pregnant mom. And now we have thousands of women, so studies on thousands of women that have looked at the vaccine, and they have not seen any increase in miscarriages or any other more significant adverse outcomes than it would be in a woman who's not pregnant. So we now know that this vaccine has great protection from pregnant women, and it seems to be quite safe. And in addition to that, they've looked at studies where they looked at the placenta, and they said, do placentas of pregnant women seem to have more disease or pathology, something wrong with them compared to the ones who, of the vaccinated women compared to the ones who are not vaccinated, and they haven't found that. And if anything, we're now seeing that immunity that the pregnant woman builds to the vaccine, that immunity, those antibodies are found in the fetus, in the baby. So whether that protects the baby in the first few months, we don't know yet, but we know that immunity is there. And we also know that a baby in that age group is highly vulnerable to bad outcomes from COVID. So much to protect and such good reasons to get vaccinated if you're pregnant.
Such an important question. We're getting a lot of questions here still from women who are pregnant or hoping to become so, and it's very good to address that as an aspect of hesitancy. Here's another question that we're getting a lot about children. Dr. Cora, as you well know, coming up, provinces like BC are already preparing for the day when a vaccine is approved for the 5 to 11-year-old children in the country. And Dinesh has a question that addresses that. He and his wife are double vaxxed, but we're very hesitant to vaccinate our kids, even though 2 of them are over 12. Kids are at a very low risk of having serious effects. So why are we being forced to get them injected? So what should parents know as this becomes imminent, one would think, Dr. Cora? What do you say to parents about children?
First, I just want to tell you some of the work. So part of 19 to 0, we have scientists who've done surveys that have looked at over 750 Canadian parents in the 5 to 12 age group of kids 5 to 12. And 66% are actually ready to immunize their kids when a vaccine becomes available. And only 18% were fully opposed. So the majority of parents actually want to protect their children. And what we hear from those parents is that they see this vaccine, they see their children's health needing to be prioritized, and they see the cost that this pandemic has had to kids, not just on their own personal health. And I'm just coming off a week and a weekend of being on call at the hospital. And I tell you, we have children with acute COVID in hospitals and in ICUs, and we have children with multi-system inflammation in hospitals and ICUs. And parents want to protect their kids against this health, to promote the health of the children, but also there's been this huge mental health, learning loss, socialization costs that our kids have had over this last 18 months in this pandemic. So parents actually, most of them want to protect their kids, but I know that a big concern for parents is safety. It always has been, and this is really important that we address safety really well, that we're transparent and supportive of parents as they go forward. But I think there's great value in children being protected. And part of the problem might be, Heather, that we're constantly comparing adult mortality to childhood mortality, which is a strange thing to do because we don't do that in any other aspects of medicine. So we have a low threshold for children's death, and we want to promote children's health, and COVID should not be any different.
Let me ask you finally, Dr. Constantinescu, I just last hour did an interview with a lawyer who's representing a couple of thousand healthcare workers in Quebec who are unvaccinated, want to remain unvaccinated, and are fighting the mandatory vaccine, the vaccine mandate, rather, in Quebec, fighting the suspension of their jobs. And Patty has a question that plays right into this. And again, on the question of hesitancy, my question is, why do doctors, nurses, and other healthcare providers who must believe in science not want to be vaccinated against COVID? It absolutely astounds me there's such a divide in opinion on this topic. But then here's the key point. How can we convince people that this vaccine is safe if healthcare professionals refuse to get the shot? So answer that as you could, if you could, what you might say to colleagues, but also, to somebody, just normal people, in conversations with family members, how would you counter someone making that point?
So, Patty, I share a lot of that frustration and upset too. And in some ways, what's happening there is that they're messengers. So they're passing on a message that is anti-vaccine to a lot of the people in the population. So I hear your concern about that. And I think a lot of that is rooted in deep fear. Tough. So we have to go at it with the same kind of support that we had before. So we have to build trust. And this is the same with, one-on-one interactions with your family members or even social media interactions. You have to have some kind of common ground with them. So don't engage unless you have common ground in a one-on-one conversation. Then you want to show true curiosity. So what are they truly coming from? And often there's a lot of fear to unpack there. So ask the questions to get at that emotional trigger. And then you have to keep it very personal. So don't engage in ideology debates. Just keep this personal. Share as to why you have come at the vaccination decision. Share those personal anecdotes, and then help them frame it in the context of their life, so that personal benefit. But at the end of the day, what I think is going to move the needle the most, especially in settings like healthcare, are mandates, and in combination with different vaccine passports in other settings. So that's, at this stage, I believe, going to change the needle the most. And in healthcare providers, it's not just about my own personal death and fear of my own life around this disease, but also protection of my patients. Mm-hmm. So that's probably going to make the biggest difference, but it doesn't mean that we still cannot have supportive discussions with the people around us.
I just so appreciate that, both from the argument within the healthcare setting, but also around the family dinner table or with people, friends and family, if the conversation continues, as it definitely is across the country. Dr. Cora Constantinescu, as always, thank you so much for your time and your expertise, and thanks for your questions as well today, putting them to our doctor.